We'll begin with the background to the study and then move on to outline its aims and the methods that we've been using, and then we'll present to you some of the findings and finish with the draft recommendations that have arisen from them. So the mental health and well-being of care experienced children and young people is a public health and social care priority. Welsh Parliament, for example, has last year published the If Not Now, When recommendations for a series of radical reforms to improve corporate parenting and support for children and young people in care in Wales. And we know that there is evidence of worse mental health and well-being amongst care experienced children and young people when compared to the general population. And this evidence comes from Wales and internationally as well. Alongside that, we know that educational settings are key for supporting the mental health and well-being of all children and young people. But there are actually limited services that are specifically for care experienced learners at school. And addressing this gap is challenging because there is little evidence of effective interventions for this group of learners and poor understanding of how health, social care and education might work together in this space, particularly at key times like moving on to college. So I'll just hand over now to Sarah to tell you about the WiSC study aims and the methods that we've been using.
Thanks, Gillian. Hello, everyone. So in order to address some of the gaps that Gillian has just highlighted, the WiSC study really aimed to explore the mental health and wellbeing support that's in place in secondary schools and FE colleges, specifically for children and young people who are care experienced. And within that, we've included those in foster care, residential care, also kinship care, and those who are adopted as well. And most of the research has been case study work to really understand how wellbeing support is both delivered and received. So for schools, we conducted secondary quantitative analysis of existing SHRN data sets, and also we did case studies in schools. So that included interviews with learners, staff and carers. We also did case studies with FE colleges. And we also wanted to look at the broad systems around schools and colleges. So we also did case studies with social work teams and CAMHS mental health teams as well, to really understand how they link with schools and colleges. And then running across the whole study, we've undertaken a series of stakeholder consultations, and that's been with children and young people, also carers and practitioners. We met these groups at the start of the study, and again over the last few weeks, where we've fed back the findings and taken on board comments on the findings and also on the draft recommendations. So we'll now move on to presenting some of the SHRN data findings.
Thank you, Sarah. So for the SHRN data analysis part of the study, we've used data from both the student survey and the school environment questionnaire. In the student survey, learners are asked who they live with, so that means that we can then compare the mental health and well-being of different care experience groups to the general population. We also use 4 questions from the student survey on learner relationships with teachers. So these are questions around things like feeling cared for and accepted by your teachers and trusting teachers as well. And we combined these into a single sort of relationships with teachers score. From the school environment questionnaire, we use a range of questions to explore school support for care experienced learners, organisational commitment to health and trauma training. So I've just selected a few things for the analysis to share with you today. So first of all, we'll have a look at the mental health and well-being of care experienced learners compared to the general population. So the chart on the left shows the findings for well-being. And you can see there that all of the care experience groups had significantly lower well-being than the general population. But also, if you look within the care experience groups, the well-being of learners living in residential care, who are in the green bar, was significantly lower than those living in foster care and kinship care, which are the brown and orange bars respectively. And we saw that same pattern and significant differences when we looked at the mental health measure within the survey as well. The chart on the right shows the relationships with teachers score, and there was a slightly different pattern here in that there were no significant differences between learners in foster care and kinship care when compared with the general population. But again, learners living in residential care had significantly lower relationship with teacher scores than those in the general population. We also used a technique called multi-level modelling to explore whether any school-level factors had a differential impact on the mental health and well-being of care experience groups. And here we found that the well-being of learners in residential homes was significantly better in schools where some or all of the staff had received training in trauma. And also it was better in schools with a written policy that recognised the needs of care experience learners. So I think a key message to come from these analyses is that the mental health and well-being of learners in residential care is of particular concern, and that some elements of the school environment might be particularly important for this group of young people. So I'll hand back now to Sarah to continue with some of the findings.
Thanks again, Gillian. So we'll now move on to report some of the findings from the qualitative aspects of the study. And this slide shows the overall participants in each setting. So in the case studies, we did interviews with a range of school staff and also in colleges. And then in social care teams, we interviewed a range of managers and also social workers. And in mental health teams, we interviewed a mixture of people working in CAMHS teams and also those working in in-reach services as well. We'd have liked to have spoken to more young people in schools and colleges, and also to more parents and carers linked with schools. But the initial consultations that we held at the start of the study were quite well attended by both of those groups, so their perspectives came through there. It's also worth noting that we did an additional consultation with adopted children and young people, and that was organised with help from the National Adoption Service. So that was another way in which young people's views fed into the study. So Gillian and I will just take it in turns now to present some of the headline findings from the study, focusing really on the findings relating to secondary schools. And then after that, we'll move on to share the recommendations. So firstly, looking at mental health and wellbeing needs, needs are recognised as being quite varied, possibly because of the different reasons and varied range of reasons that young people enter care. Needs also varied over time, and there were a range of elevated needs at times when elevated needs were identified. And staff, pupils and carers were really in agreement about heightened need during the transition from primary school. So the pupil that we've included in the example here spoke about increased anxiety because they were also moving from a different area as well as moving to a different school. So there's lots of change, lots of new things going on in their life, and lots of different people to interact with. There were other times of elevated needs as well, and this included links to care-related events, which could be sort of triggers for well-being needs, such as maybe a new baby in the birth family, or perhaps a time when parents' addiction levels were increasing. And teachers across different schools really noted problems generated in the lead up to the long summer holiday, with this creating maybe a period of loss of stability and support that they usually found at school. They also spoke about exam time as a key pressure point for all pupils, but noted particular anxieties for those who were care experienced. School staff also identify some of the ways that school practices and policies could inadvertently increase need. So that maybe included supply teachers, which represented a change in normal routines. Staff at schools also spoke about attention being drawn to pupils, maybe when they were taken out of lessons for a care-related reason or meeting. And they also noted some concerns around class management approaches that may impact well-being for some care experienced pupils. It's also important to note, though, that some young people were quite clear that they didn't feel they had any needs. So the young man in this example was in quite a settled placement. They had changed schools, but generally he said he was okay. And this resonated with some of the feedback we had from college students, where they said they knew about the support available, but they hadn't used any of it because they had been fine. So I'll now hand over to Gillian again, just to talk through some of the school provision that we found in place.
Thank you, Sarah. Yeah, so When people talked about the wellbeing support that was available for care experienced pupils at school, their descriptions and experiences largely fell into these 4 nested levels. And this is quite a common way of thinking about mental health and wellbeing support at school, which I'm sure many of you will be familiar with. So at the outer sort of whole school level, we've got the things that the school has or does that determine its social environment. So what it feels like to a pupil to be at the school. So examples of things we were finding here were things like being a community school, which one of our case study schools was, and having senior leaders with wellbeing roles. Then the next 3 levels represent the things that are sort of directly delivered to pupils, either universally to all, targeted to specific groups, and finally things that were specific to those who are care experienced. So at that universal level, wellbeing support was being offered through the curriculum, assemblies, extracurricular clubs, and all of our case study schools had wellbeing rooms with staff available in them for pupils to speak to. Then at the next level down, the targeted level, support was largely a more sort of focused version of some of the elements of the universal support, but with particularly close monitoring of certain pupils. And ensuring that vulnerable pupils had a trusted member of staff that they could talk to was a key element of this sort of targeted support level. And we also saw a wide range of staff and external professionals involved here. So we had some ELSAs, wellbeing officers and school nurse, and also a range of sort of therapy or counselling type interventions being available, as well as some wellbeing spaces and extracurricular clubs that were for particular groups of pupils. So for care experienced people at the school, of course, all of the above will be available to them, but we were most interested at that 4th tier with what was available for those who are care experienced. But interestingly, the first thing to really emerge from the data was that just being in school per se could be a source of support for some care experienced pupils. In the interviews with them, some of them were able to describe what their favourite lesson was and what clubs they joined and the friendships that they had with their schoolmates. So there was a clear sense that they were engaged with their school and got some benefit from being there. And adults also highlighted the constancy that school could offer some of these young people in, when the rest of their life might be quite turbulent. But there was, of course, a flip side to that as well, and some care experienced pupils clearly found the school environment quite challenging and stressful, and some equally were in the middle and just seemed quite indifferent to school as well. So all of our case study schools had members of staff with specific responsibilities for looked after children, but we only came across one person whose role title also included adopted children as well. And there were actually few examples of provision that was specifically for care experienced pupils. Instead, the case study schools were taking a more individualised approach to care experienced pupil support that was tailored to their needs. But a core part of that was encouraging care experienced pupils to join in school life, doing things like joining extracurricular clubs or putting themselves forward for the school council. And that's what the quote on this slide is about. And the rationale for this approach was that care experienced pupils didn't want to be singled out in any way, that their needs were very varied and provision really should be needs-based. The most prominent thing that schools were doing, however, was ensuring that the care experienced pupils had an emotionally available, trusted adult that they could talk to when they needed to, and to reassure them that staff at the school were there for them whenever they needed, through sort of frequent check-ins with them. And finally, just to note here that nobody really talked about support for adopted pupils, other than to acknowledge that there was nothing specific for this group. So we also found in the data some information about the barriers and facilitators around supporting care experienced children at school. So for the barriers, a lack of staff understanding, knowledge and awareness of the care experience came through quite strongly. And at times that was linked to to fear and a lack of confidence in working with this group of children and young people. Also, school staff's capacity and funding available to them to offer support and provision that they and others wanted them to was perceived as a barrier. And when I say capacity here, I of course mean at the time school staff had, but also the emotional capacity and resilience of staff that they needed to work with this group of young people. And there was also a sense that this group of children can actually be quite a challenging group to work with sometimes, and for very understandable reasons. There can be a lack of trust in adults due to their past experiences that they've been through, And as I've already mentioned, just not wanting to be marked out in any way as care experienced, which is what the quote there is about. On the facilitator side, relationships really came through as key between the school and parents and carers, the school and its young people, and the school and external services that they're working with. So staff knowing the care experienced pupils really well was crucial. And of course, then their skills, attitudes and attributes, and also consistency and role were really important in helping to forge and sustain those relationships. And the quote there is from a sixth former looking back on her time at school and just thinking how important it was to her to have the same member of staff that she could go to speak to over all of that time. And then staff collaboration and teamwork were also highlighted, and staff saw the importance of sharing their experiences and supporting one another in their work with care experienced pupils, and ensuring that the right information was shared with the right members of staff within the school as well. And finally, sort of drawing on and collaborating with external providers was perceived as important too. So I'll hand back now to Sarah to continue to talk through some of the findings.
That's great. Thanks, Gillian. So one of our areas of focus and study was the transition from secondary school to FE colleges and what support was in place at the time. So first of all, looking at what facilitated support around transition. In some cases, we found that it was close working between schools and colleges. So they identified care experienced learners and they provided enhanced support, including maybe prioritising access to careers advice, just to make sure they made good decisions about which course to take, maybe arranging visits to college at quieter times so that the change wasn't so overwhelming. And schools also provided colleges with sort of details about support mechanisms that had worked well in schools. So the example there from the ALN coordinator in the school says about the importance of having that daily contact or daily check-ins. And that was important for that pupil to ensure they had good attendance. So they passed that on to the college. Participants also spoke about some of the barriers or challenges to providing wellbeing support on transition to college. So a similar point about schools, really, what Gillian's just mentioned, that desire for anonymity. A common theme was around care experienced young people not wanting to be seen as a group or treated any differently to other students. And that really linked to what they also said about growing independence and wanting a fresh start in college. Another key barrier then was for staff in college finding out who was care experienced. A big barrier for colleges was identifying who was care experienced on entry. They wanted to put in place that enhanced support, but often they had limited information either from local authorities or schools. And in some cases, colleges really felt they were on the back heel in terms of knowing their new cohort of students. And we also found that that became even more of a challenge then when perhaps they were working across multiple local authorities, and also they had out of area students as well. So this is the final slide then on study findings, and it links back to what we said about the start, about how we were also interested in these broader systems around schools and colleges and how they work with social care teams and mental health teams. So there are a few headline findings about multi-agency working and what seemed to facilitate that. Firstly, there seemed to be improved relationships where you had practitioners or professionals from one discipline or background being placed or embedded in another service. So, for example, it seemed to help where in-reach workers maybe had backgrounds in teaching, or where social workers had roles within CAMHS. Another practice that seemed to work really well was where head teachers represented on foster care panels. That seemed to really help build relationships and help schools understand the realities of fostering. Participants also spoke about the importance of spanner roles, where individuals spanned or worked across different agencies to improve support for young people. So some examples that we came across included the virtual school. So they were local authority based, focused on educational needs of care experienced pupils, and schools really describe positive links with social care being driven by the virtual schools. They often help them find the right social work team to contact, and they were really helpful for schools where they had out of area placements as well. And then a new role, which several different participants spoke about, was the specialist practitioner for care experienced young people based in CAMHS. So it also helped that they had a social work background, but lots of different stakeholders spoke about the importance of that role in really spanning across schools, social care and mental health. So I'll just hand you back to Gillian now to take us through some of the recommendations.
Thanks, Sarah. Yeah, so we've made a series of recommendations to try to take forward the findings from the study, and we have 4 recommendations here that are aimed at schools. So the first one really stems from that finding around the fact that just being in school is good for some care experienced pupils' wellbeing. So, for example, when I asked a head teacher what care experienced pupils' main needs are, he instantly said, oh, they need to feel like they belong here. And we also thought that the findings around the importance of trusting relationships with staff and of friendships could be incorporated into this single recommendation around that sense of belonging. The next recommendation is around individualised support that the case study schools were offering, and we don't know how widespread that is, so we thought it's important to try and give it some prominence and include it as a recommendation from the study. And in this recommendation, we've also included the values of pupil choice and control and the involvement of parents and carers, because the wide variability of how schools collaborated with parents and carers came through quite strongly in the data. The third recommendation is around adopted children and young people's needs, and the finding that little seems to be in place for them specifically, and awareness of their needs is sometimes quite low. So there are a few suggestions we've included here as well on how that might be addressed. For example, perhaps schools could have a governor with responsibility for adopted pupils, or the virtual school that Sarah was just talking about. You know, it's important that that's adequately resourced to include adopted children as well as those who are fostered. And then the fourth recommendation was around school staff wellbeing and recognising the need for a resilient and well-supported workforce. But the responsibility for that should really be shared between schools, local authorities and Welsh Government. And we've added some suggestions to this recommendation around training to help build confidence, supervision for staff who are working with care experienced pupils, and perhaps establishing some support networks for pastoral staff.
Thanks, Gillian. So this recommendation relates to the transition from schools to college, and we've got 2 parts to this recommendation. So the first part really relates to the findings about transition support being in place in some but not all colleges. So we're suggesting that maybe we have one person to oversee that process. So we found that some teachers were doing this informally. Perhaps this could be part of a new role or part of a role for young people's advisors. And as part of that, quite important that they signpost to careers advice, and really important that they inform the college about the care experience status, and that really addresses findings about colleges not always having that information passed on. And then the second part of this recommendation, we're also suggesting that transition could be strengthened by schools and colleges maybe collaborating on a more long-term basis. Perhaps working together in the same way as primaries and secondaries work together in the cluster model. That seems to be working well for schools, but not sure if it would work in colleges, given that they often have much wider catchments.
And then we also have some recommendations that really apply to both schools and colleges. So the first of these focuses on investment in pastoral staff. And it's calling really for sort of partnership working to try to clarify the pastoral roles and the sustainable funding that's needed for those roles in order to successfully implement the whole school approach and its equivalent in colleges, and to ensure that pastoral staff is also responsive to care experienced learners' needs. And then we've also got a recommendation around provision of Welsh medium resources, because this is clearly an issue in some of the schools that we spoke to who have large populations of Welsh speaking students. So we have a recommendation here around that, which is really trying to seek to take the burden of translation off of individual schools and place it on the providers of those resources, or failing that, perhaps that's something that consortia could help with.
And then this recommendation, number 8, really links closely with the findings we just presented about multi-agency working and what facilitated that. So the first part is about embedding people of different backgrounds into services. So examples we came across, as we said, were social workers in CAMHS teams, or maybe teachers working in in-reach services. We also mentioned that teachers were, especially head teachers, were represented on foster care panels. That seemed to be worked well, but wasn't happening everywhere. And another example we came across were secondments. So some interviewees spoke about this happening in the past, and that had really helped strengthen multi-agency working. Then the second part of this recommendation is about the investment in spanner roles to work across services. And the two examples we came across was this CAMHS specialist practitioner role, a really valuable new role, and also the role of the virtual school, which seemed to really improve links between schools and social care. And then the final recommendation, this really cuts across all the other recommendations and really relates to the findings that support seemed to be most useful when young people had helped shaped it, but they weren't always involved in the development. And parent and carers often felt left out, so they seemed to have lots of experience and knowledge, but they weren't always included in discussions in schools and colleges. So with this recommendation, we really wanted to give quite good prominence to children, young people and parents, carers' voice in all future developments. So that brings us to the end of our presentation, really. We're due to submit a final report to the funder over the next month, and then we'll move on to trying to disseminate the findings and recommendations as widely as possible. And as part of that, we've included plans for a policy briefing for practitioners in education, health and social care, and also a policy briefing for children and young people as well. So a huge thanks to you all for listening today. Diolch yn fawr iawn I chi gyd. We're really interested to hear your views and comments, but many thanks for coming along today. Diolch.
Thank you.